Hello, Dr. Matthias. My name is Tram, and I am a student pharmacist. Today we have our patient JK, a 20 years old female, who present to the urgent care with having diarrhea and still having pain while she's peeing. She was recently diagnosed with uncomplicated UTI and currently taking Augmentin, 875 milligram by mouth twice daily for 7 days. She's also diagnosed with vulvovaginal candidiasis. She's also taking buspirone for generalized anxiety and also rifampin for latent tuberculosis. Other medication she's taking right now is multivitamins, ferrous sulfate, and also Tylenol. She's allergic to Bactrim and it causes her rash. Her vaccination is up to date except for her Tdap. With her physical exam, it showed that she has a white exudate, thick, curd-like discharge, inflamed tissue in her vaginal. In her stool, it shows that she has enteroaggregative E. coli present, as well as the C. diff with the positive glutamate dehydrogenase and negative toxin. Her urinalysis today showed that her white blood cell is 35 and her red blood cell is 2. There is a trace of protein, nitrite, and also leukocyte esterase. For the urine culture and vaginal smear is still pending, but the gram stain show that she has gram-negative broth and also presence of yeast. First of all, I would like to recommend her switching Augmentin to nitrofurantoin monohydrate 100 mg by mouth twice daily for 5 days for the uncomplicated UTI. Augmentin is not recommended due to the high incidence of E. coli resistance, and it may also be the underlying cause of diarrhea. I would also want to reassess her signs and symptoms to see if she has improved after 48 hours of starting on nitrofurantoin. Also, I want to monitor her serum creatinine to see if her renal function is stable. For her diarrhea, I would recommend to discontinue the Augmentin as we said that it has a common side effect of diarrhea. I would like to order the C. diff PCR to determine the presence of toxigenic C. diff infection. If it is present, then I will isolate her and start her on vancomycin, 125 milligram by mouth 4 times daily for 10 days. Because her white blood cells is less than 15,000 and also her serum creatinine is 1.5, less than 1.5. Then vancomycin is considered a first-line affected agent for C. diff due to its low risk of recurrence. If toxigenic C. diff is not present, then I would want to rehydrate her with the oral rehydration solution with 500 milliliter per hour up to 2 liter per day. And I want to monitor signs of dehydration and also check her vital signs every 12 hours. For the vulvovaginal candidiasis, I would like to recommend starting her on clotrimazole 1% cream with the instruction of 5 grams intravaginally daily for 7 days. As azole is a good topical treatment and is a first-line therapy which has fewer systemic side effects. For latent tuberculosis, I would recommend her to continue her rifampin regimen of 600 mg by mouth daily for 4 months. After that, we would wait for the lab culture, the PPD skin test, and also the chest x-ray to see if she is fully free of tuberculosis. For her generalized anxiety disorder, I would recommend her to hold off on the buspirone as it has an interaction with the rifampin. And I would like to switch her buspirone to escitalopram 10 mg by mouth daily at bedtime, as it is one of the first-line agents for generalized anxiety disorder. With the starting of the new medication, I would want her to self-monitor for her signs and symptoms, and she is recommended to contact her doctor right away if her anxiety is not controlled. As for ferrous sulfate, I would want to discontinue in that because we don't have any indication for it. And I also want to know what is she taking the acetaminophen for, as well as what is strength that she's taking and how much she's taking per day. Before the patient is discharged, I would like to administer the Tdap vaccine to prevent any further infection with tetanus and diphtheria. Also, I would like her to visit her primary care physician after 1 week to follow up on her uncomplicated UTI and also vulvovaginal candidiasis. Thank you for your time.